My name is Clinician Birunji Roven, and in today's video, we are going to be looking at enteric fever, or rather, it can be called typhoid fever. So, first of all, we need to know what is typhoid fever. Typhoid fever is an infectious disease. It is actually contagious. What am I trying to mean? It is contagious, so it can easily be spread from one person to another, even through contact, like person to person. So typhoid fever is caused by a bacteria known as Salmonella enterica. And we have specifically two types of serotypes which are infectious to us human beings. That is Salmonella typhi and Salmonella paratyphi A and B in particular. Now let's try first of all look at let's first of all look at the mode of transmission. When we are to consider the mode of transmission, typhoid is specifically transmitted through fecal oral route. That is the main mode of transmission. Feces, fecal matter from an individual who is infected get into our water supply or food chain. It would mean that everyone who would feast on that water or food would become sick of, or would contract rather, he would contract typhoid. That's what we were trying to mean with that it is contagious. The second route of transmission is by fleas and cockroaches. Some insects, most especially fleas and cockroaches. Cockroaches may go to the toilet, or they may go to a where an individual with typhoid had urinated previously. They will carry that bacteria, those bacteria on their bodies, and end up contaminating our food chain. The third method of transmission is through person to person. If we have an individual who is sick at home, an individual with typhoid fever, chances will become higher of even us becoming infected, the family members. Why? Because of its ability to be transmitted from person to person. This person rituals or rather poor hygiene habits, they may go to the toilet. After visiting the toilet, they may not wash their hands and they end up touching maybe the plates we shall all use. We can end up shaking hands with them, and in that process we would have ended up contaminating our hands. And in the case we use these hands to take a meal, donut, and we take, then we would probably also become sick of typhoid. We would contract the infection. Now, we are going to be looking at one of the characteristics of typhoid. So we know that typhoid is endemic in nature. It is endemic in nature. So what is endemic? This is like it can hit, if it appears in a particular area, you find it infects so many people in the area. It happens in masses. So you find so many people become infected, so many people become sick, most especially when it gets into our water supply chain or our food chain supply. Why does it have such capabilities? When you take a closer look at the bacteria that cause typhoid, that is the Salmonella typhi and the Salmonella paratyphi, you'll find out that typhoid, actually, these bacteria have the capability of surviving in water for 2 to 7 days, whereas they have a capability to survive in sewage for actually a period that ranges between 35 to 70 days. That is roughly 2 months. So they can survive in sewage for over 2 months without dying, and they can survive in water for over a full week. So that's one of the capabilities. Now, right now, let's not even waste any time and we start looking at the pathogenesis of typhoid. So in the pathogenesis of typhoid, first and foremost, typhoid is going to contaminate either our water or food chain supply. After contaminating, we shall ingest contaminated food or water. This bacteria will be capable of surviving the acidic medium, the acidic environment of the stomach, and they will end up reaching our small intestines, the ileum, without them dying. When they reach the ileum, they are going to take refuge into the mucosa of the small intestine. And in the mucosa of the small intestine, as soon as they enter, this is going to induce, it is going to stimulate the defense, the immune response of our body. Therefore, phagocytes are going to be released, most especially macrophages are going to be released into the mucosa of the small intestines. These are going to engulf, these bacteria and take them to the regional lymphatic system of the small intestine. That is the lymph nodes of the small intestines. There in the lymph node, these bacteria are going to multiply. They are going to increase in number. And this usually takes place between a period of around 1 to 3 weeks when they are actually just inside the lymphatic system, the regional lymphatic system of the small intestines. So they will keep on multiplying and they will increase in number. And actually the period of 1 to 3 weeks depends. This period may even become smaller in agent. Salmonella typhi and the Salmonella paratyphi A-B serotypes. So after that, are going to go and enter into our blood. And at this stage, we are going to know this, we are going to be calling this stage the bacteremia stage. So this is going to be our bacteremia stage. So in this bacteremia stage, these bacteria move from the regional lymphatic system into our bloodstream. So they start moving through our blood. And this is when we start seeing most of the symptoms, the symptomic features. So we shall start having headache, things like diarrhea will arise. First of all, diarrhea will start initially as soon as they reach the regional lymphatic system. So this time it will become even more often. The stomach will become like, the abdomen will become more tender on touch. So all that. Now we want to look at the signs and symptoms of typhoid. So when we are to consider the signs and symptoms of typhoid, these ones are going to include the following. One thing you will always expect of typhoid is diarrhea. If not diarrhea, constipation. In most cases, constipation comes first, then diarrhea follows. But in other cases, diarrhea comes without even constipation appearing at all. 2, a fever. Fever. This will going to be characterized with temperatures of 38.5 degrees and above. This fever is going to be this kind of fever which is undulating. Like it is going to be a gradual increasing fever. You find the fever will keep on increasing. So it is a constant fever, but gradual increasing. So it starts from 36 degrees, that is normal, goes to 37, goes to 38. It will keep on increasing. And it will be a constant fever. It will be a fever which will be on all the time. 3, back pain. 4, malaise, that is feeling of unwellness. The person, you will start feeling that you are unwell. That is the feeling of unwellness. The individual will start feeling that is really unwell, but when they are actually not sure whether they are really unwell or not. Another thing, eye pain. You start having pains in the eyes. You start having difficulties with opening your eyes and seeing. We shall also see things like muscle pain, that is myalgia. And we shall also not see other symptoms. Some of them might be, they are more common symptoms. They are symptoms that are just general. They are generally symptoms to all infections that result into a fever. Things like loss of appetite, things like loss of weight over time, all those ones. Now, we want to look at right now we want to consider the complications of typhoid, complications that arise with typhoid. When we are to consider the that arise with typhoid, complication number one is always perforation small intestine. So there is perforation of the barrel, since this bacteria will keep on coming into entering into the mucosa, moving out, entering, going into the blood again. It is like a cycle, it will keep on continuing. It is a continuous cycle. So perforation of the barrel. We shall also have things like inflammation of the bones. That is bone infection. The bones may become infected and they will become inflamed. So we shall have such complications. Another common complication is actually dehydration. In most cases, it can actually be severe dehydration in case it is not managed at a early stage because of the high diarrhea associated with typhoid. We shall also have complications like septicemia, most especially if the bacteremia load increases or overrises in the blood. Now, let's consider the treatment. Before we consider the quick treatment, we need to first of all consider the diagnosis. So in the diagnosis of diarrhea, step number one, we can use culture. So here we use blood culture. You can also use stool culture. So you can use stool or rather blood culture. So here what we are going to do, we are going to pick samples of blood, take them to the lab, and they will be cultured for that specific Salmonella bacteria. This is usually done at the same time as we are doing sensitivity test in order to find out the most efficient antibiotic that will actually work on in the treatment of this typhoid infection in that particular individual. Actually, another culture we can use a rose spot culture. I forgot to talk about that in the symptoms of typhoid. With rose spots, these ones they are like swellings, inflammations on the skin. They usually come around the chest and the abdomen. And when the individual is sick of typhoid, when the individual becomes infected with typhoid, they tend to come around the chest area and the abdomen. They are called rose spots. They may appear like measles, but they're actually not measles. So you can use rose spot aspirant. So we pick out the fluid from those rose spots and we take them for culture and sensitivity. The second method of diagnosis can be the serological test. In serology, we are actually looking at the antibody, whether our body has produced antibodies against the typhoid bacteria, that is the Salmonella typhi or Salmonella paratyphi. So these are more of quick tests, they are more of rapid tests. We are looking at whether the body produced antibodies. We may use Typhoid or we can actually use Tubex. Note that in some countries, people still use widow's agglutination, but actually, widow's agglutination may not be so specific for typhoid infection because it can actually, one test done on an individual and it comes out as positive, it is not conclusive that the individual has typhoid. Because with widow's agglutination test, we can easily end up with positive results even when the individual is not sick, as long as that individual has ever been exposed to the bacteria, meaning that they already have antibodies against typhoid bacteria in their body. When we consider the treatment, in minor cases of typhoid, we are going to be specifically using antibiotics in the treatment of typhoid. we shall be using antibiotics, and we also have to make sure that we consider rehydration, because typhoid it always comes with a lot of dehydration. So consider rehydration. In case the dehydration is so severe, it is better to use the intravenous rehydration. We can use intravenous fluids. In case it is not very severe, we can use oral fluids. We give ORS in kids. In adults, we encourage taking a lot of fruits, a lot of water, a lot of fruits, and so on, juice. Then for cases of severe typhoid, when it's very severe, then we are going to use drugs. We are going to specifically be using corticosteroids for treatment of severe typhoid. Corticosteroids, when we are also treating severe typhoid, endeavor to consider rehydration. Endeavor to consider rehydration. I thank you for watching this video. I'm clinician Birungi Roven from the Medical World channel. Don't forget to like and subscribe. You can also click on the notification button just below there so that we keep you notified whenever we post educative videos like this one. Thanks.